All right, Sonia, before we jump into the purpose of this video, that being signs and symptoms that you may have sleep apnea, could you just tell me a little bit about how serious this actually is?
It's pretty serious. It's a pretty um, common disorder. So it's estimated 28 million people have sleep apnea.
Mm.
And a lot of people just don't even realize that they have it. This has been sort of becoming more and more in the public eye over the past 20 years just because of the increase in research and doctors' awareness of the effects of untreated sleep apnea. But, you know, also just the rising obesity rates. I think it's just becoming more prevalent and people are talking about it and seeing it more. But a lot of people don't know about sleep apnea. A lot of people still don't understand what it's even a thing to be concerned about. One of our local physicians was talking to us the other day, and he estimated over 50% of people have it. But
Mm.
sadly, a lot of people don't realize it. They don't know that they should seek medical advice about it. But it's pretty serious and pretty common.
Yeah, we've noticed a big spike in it for sure in the past,
Hmm.
even 10 years. So let's jump into the purpose of this so we can help people identify whether or not they should take this seriously. So, what are some signs and symptoms?
Well, probably the biggest one, if your partner tells you that you stop breathing, that you gasp in the
Yeah,
night, or just totally stop breathing, or there's a break in snoring, I mean, that's definitely not something to ignore.
that's
If
literally
you've
called a
been,
witnessed apnea.
yeah, if you've been told that by someone, um, don't, seek medical advice. Go talk to your doctor about
Yeah.
it. And if you notice that about your partner and they're trying to downplay it, don't let them talk you out of it. Like next time they go to the doctor, speak up and say
Hmm.
something about it because that's pretty.
That's the definition of sleep apnea right
Yeah,
there. Yeah.
that is definitely, yeah. But other things too, I think that a lot of people associate with sleep apnea. So things like snoring, waking up, not, feeling like you didn't sleep,
Hmm.
falling asleep at inappropriate times. Like if you go watch a movie
Yeah.
or you're at dinner with the family, even just falling asleep. Um, and also, too, just a lot of um, other medical conditions that they seem unrelated, but they can all kind of be linked back to sleep apnea. So things like hypertension,
Mm.
atrial fibrillation, uncontrolled type 2 diabetes, and it's things like lack of concentration, memory loss, waking up with headaches, waking up with dry mouth, things like that, um, and even mood disorders. So, depression and anxiety. So, if you're not sleeping well, you're not healing well.
Mm.
And over time, I mean, everyone knows that you get cranky when you're tired. That's no big mystery there. But over time, it's
Turns
can
into
lead
a
to,
condition.
yeah, an actual medical condition. And also like nighttime trips to the bathroom. Getting up lots of times in the night to just, you don't understand why you're waking up, but you just know you're waking up, tossing and turning, things like that. Those are all signs that you've got untreated sleep apnea.
Sonia, one thing that we see time and time again is how shocked our clients are when they're actually diagnosed with sleep apnea. And the main reason for that is because they actually think that they sleep very, very well. Uh, what do you think about that?
Yeah, Ian, so we see that all the time. And the reason is people have normalized their poor sleep habits.
Hmm.
And so when they have their sleep study and they see the results, it's an absolute train wreck. And so, but even shockingly, still sometimes people are not believing of those
Yep.
results. And so, but they start therapy, and they come back to see us, and they're like, Sonia, I had no idea I was how badly I was sleeping and how good I could feel.
Yep, that definitely rings a bell. So, for the people out there that think that they might be at risk of having sleep apnea, what should they do?
So, if you think you have sleep apnea or a loved one has sleep apnea, the first thing you need to do is to determine, are you actually at risk? There's a survey that we have that's used by doctors, like pulmonologists, sleep medicine doctors, family doctors who are diagnose and treat patients for sleep apnea every day. They use this survey to determine if their patients are actually at risk. We have that survey. We would love to send it to you. So fill out the form below and we will send it your way immediately. Um, and if it turns out that you are at risk, don't worry. We're also going to be sending you action steps so that you will know exactly what to do next to get to the bottom of this and get on the path to treatment,
Mm-hmm.
as well as tricks and tips for what you can do in the meantime before you even see a healthcare professional to combat the effects of sleep apnea. But again, the first step is determining, are you actually at risk. So take 30 seconds, fill out the form below, and we will send that to you.
Awesome. Appreciate your time as usual.